Good afternoon and welcome to AUC's Campus Conversation. With just a few days away from the start of classes on Sunday, September 5th, we are very excited to see the campus buzzing with activity despite precautions we've all taken. Today's session will focus on AUC's Back to Campus plan and measures that are being taken to ensure both a productive academic semester and a safe work and learning environment. We'll first begin today with some brief updates from our panelists, and then I'll open up the floor to questions. To ask a question, you can use the raise hand button on Zoom, and when I call your name, you'll have access to speak, and you can unmute your mic and ask your question. You may also type your question in the Q&A box below. It's my great pleasure to introduce our panelists, all senior members of university's leadership, Provost and Acting President Ihab Abdulrahman, Vice President for Student Life, Dina Burai, VP for Management and Operations, Shireen Shakar, AVP for Human Resources, Sarah Rafat, and Dr. Hussam Hassan. We await your comments first, Provost Ihab.
Dr. Michelle, thank you very much for your introduction, and thank you for agreeing to moderate that session. Let me start by, again, thanking all the team who has been working really hard to prepare the campus to reopen on September 5th. We're very few hours away from reopening the campus, and we all are excited about it. I also understand that we also are anxious about reopening the campus. And you're not alone. If you're anxious about reopening the campus, I want to tell you that you're not the only one who's anxious about that. But I would also invite everyone to support his or her colleagues around them. Please let us support each other, because this is not an easy transition, and we understand that this is not an easy transition. So on September 5th, campus will be open to everyone. We have reached a good number of vaccination, and I would like to thank all community members for their collaboration and for their help to reopen the campus. Students, faculty, and staff have been doing a great job in getting to protect themselves by getting vaccinated. We're now at the stage of 80% vaccination. That's a very good percentage of our community. And 86% of our community have already, and the others, there is 6% of our community who received medical exemption, either because they are under 18 or they have a medical reason not to get vaccinated. The other 14% are not vaccinated yet. We know that the vaccination will end at EUC today. However, we will be discussing with the Ministry of Health to extend the duration of availing the vaccine for our community for a few days during the first week of classes, or maybe the first week of classes. This is not guaranteed yet. We will let the community know if they agree to continue the vaccine on campus during the first week of classes. I will leave to my colleague, VP Shireen Shakar, to give more details about reopening the campus. But I just want to stress that we're facing very unknown challenges, but I'm confident that we have the team that have the agility and the creativity to face those situations. And also I'm confident that the community will help us to face those situations. Just before I end my remarks, I wanna encourage and ask everyone to maintain a social distance and also to wear the mask. If every one of us wear the mask, then we don't have to worry about others. So please wear your mask, focus on yourself, wear your mask, and protect yourself. And with that, I go to my colleague, Shireen Shakar.
Hello, good afternoon, everyone. As the Provost Acting President just mentioned, that we are really all very excited that we are getting to the start point of the new semester and getting ready to welcome our students back on campus. As everybody knows, we've been working extremely hard in the last few weeks and months to do all the preparations necessary. That is, of course, more challenging than any normal summer. Usually the summer we do take the time as operations to equip the campus, to do all the maintenance works, etc., to be able to open. This summer we had the added complexity, of course, of catering for all the COVID-19 added complexities. In terms of maintenance, we've made sure that all the classrooms and all the buildings and the offices, the ventilation systems are equipped with more fresh air intake, so that because of the contagion. So we've set all the air conditioning systems to basically have a 40% fresh air intake, and thus having the classrooms at the maximum safety that we can put it to work at. We've done all the furniture setups and switches needed to enable social distancing across 100% of the classrooms on campus with the 1.5 social distancing requirement. So there was a lot of furniture changes entailed to doing that, and we're now 100% complete. So all the classrooms are set up nicely with all the signage and marked on the floor where the chairs should be at, so that no one moves the chair and messes up the social distancing requirement. So this is meant to help us all maintain the classroom setup as safe as can be. All the signage has been done on campus, also to encourage everybody to wear masks, and at the entry doors, this is also highlighted by signage. So we've renewed all the signage on campus. We've availed more outdoor spaces. So all the, we've done a few initiatives to cater, especially and specifically for COVID-19. We've delivered 3 outdoor classrooms that can be used by faculty and students. For example, if a class has a COVID-19 case and that class, while it's being closed and cleaned and disinfected, the class can meet in the outdoor class. This will be managed by the registrar, but this is also a COVID-19 specific, let's say, initiative. We've delivered also a small number of dual delivery classrooms that is also managed by the registrar in order to also cater for the whole pandemic and the COVID-19 situation. So all these are things that have been done on a fast track in order to basically make it for fall. We are now in the process of opening all the food outlets. So beginning of the week, most outlets will be open. There will be a few that will be opening midweek, but by end of the first week, we expect the full campus to be buzzing, we hope, and including all the food outlets. Of course, the eating areas are also social distanced. We encourage the use of outdoor spaces more within the main cafeteria and other eating places, so that this is also done in a safe way. So much has been done for the vaccination program. So the second big round now that is happening on campus, the last days today, we do hope we're able to get a few days of next week, but so far the vaccinations taking place and the numbers is actually fascinating and amazing that we could do that in time for the fall semester to start, and equipping all the community members and especially students with the high numbers to really make it and to make it on time. We've also established, and we've just finished testing we've got now 10 testing units by Prime Speed, the partner that we've been working with over the last year, whereby people who are not vaccinated for any reason will be required to do the weekly antigen test. We've set up the testing stations. The operation is now ready to commence first thing on Sunday morning. So if you have not been vaccinated, you will receive an email that would explain exactly the logistics of what you need to do throughout next week to be able to go to your first antigen, to get your first weekly antigen test. It's a nasal swab, and this will be done once a week. Of course, try to pick a day that suits you throughout the semester so that you go on the same day, because that will be the weekly deadline or the weekly day that you go. How that will work, we have, of course, done a lot of work in the background on the systems part of things, whereby in the morning, anybody coming to AUC, faculty, students, or staff will be submitting the online health system, same as we've done last year. There's an addition to the system whereby if you've been vaccinated, it pulls automatically from the vaccine tool where you have uploaded your data, so that in case you're vaccinated, you get a green thumbs up on the screen on your mobile, and that will allow you to ride the buses if you're a bus rider, go use the gym facilities, or Some events will be restricted to vaccinated only, so that is now available on the tool. This took a lot of also development time and weeks from our IT teams, but this is now in production. So if you try it today, you'll find there's a new icon that's been added, which is this thumbs up. You'll get a thumbs down if you have not been vaccinated, but next week, if you go to your antigen test on time, this will allow you full access to campus the week after. So of course, needless to say, all these systems work took a while, but we're finally there, and we've launched them in production. The buses, of course, all the signage is in place on the buses. This is really mandatory to keep masks on all the time throughout the bus journey, not just when the riders start on the bus, but it is required to keep the mask on throughout the full journey. It is a closed space, and taking off the masks, especially in buses where it's very difficult to social distance, it is really very, very important. Apart from all of that, there's a lot of now the campus cleaning and sanitizing schedule. Every day and every class will have at least 2 full cleaning and disinfecting cycles in the morning and the middle of the day. And this is also part of the whole plan. And this starts, of course, on Sunday morning. Again, the most important message is to really please take masks on very seriously. The numbers in the country are still climbing. They're climbing at a low rate still. However, the situation may start evolving in a negative way, and our ability to really keep our campus safe will, of course, as much as possible, either help us or go the other way. So we do encourage and we request that everybody take the masks on extremely seriously, especially for closed spaces, common spaces, even outdoors. If there's a number of people meeting together, that's still a requirement that the masks are kept on. We do want to open safe, we want to stay safe, and we want to remain open. That's also a very important target. And we know that if we don't take things seriously, then we may not be open for a very long time. And that's really not where we want to go to. So that's a plea of please keep the masks on, especially when there's more than one person in the room at the same time, in any shared spaces and elevators, and in any food outlet, the bank, etc. All these spaces. So that's a glimpse of the work that was going on in the last few weeks. Again, we do welcome everybody on Sunday, and we're very happy to finally have an open campus. Thank you.
Thank you, VP Shireen. Perhaps I could ask VP Dina Barai to say a few words about student life.
Yes, of course. And I want to echo my colleagues. We're really, really excited at welcoming students back for the last 3 days. Today is the 3rd day of the first year program orientation. And we have about 1,100 students being introduced to life at AUC and preparing them for their first year. And I just want to say that I want to echo what the Provost said, that yes, we are extremely excited and delighted. At the same time, we do acknowledge some stress and anxiety as we go down a new path of back on campus during COVID. And I wanted to say that in student life, for any students who feel they want to talk to someone and feel anxious, that in the Center for Student Wellbeing, we're there to support you. And so please contact the Center for Student Wellbeing and wanting to talk to someone. And we will also be setting up some well-being conversations that you can join in the next few weeks, again, to help us return back to campus. I also want to say that there was a question about masking. Every one of us as a community, we should be supporting each other and making sure that if any one of us, whether it's an administrator, faculty member or staff, if we see a student without a mask, I would please urge you all and us all, working of course with as a community, that we remind students the importance of masking and making sure, as the Provost said, ensuring the safety of themselves and of course of others. So we need your help. It needs a whole group of us to do that, working together in harmony. And so, which brings me to the idea of return to campus, yes, but we can't be doing everything as we used to regarding, for example, student events. We're encouraging students to organize their events outdoors because that is far safer than indoors. And again, making sure masking and social distancing and so on. So this is very important for us, regardless of whether we're doing indoor or outdoor events. Masks are required, students, please. The only time that you may not wear a mask is when you're alone outdoors. But once you have people around you, please, students, put on your mask. We can't risk anything. Back to the other facilities, the athletics facilities. They are open. They've been open since last week. Everyone has access to outdoor athletics, the facilities, the fields, and tennis courts. But regarding the pool and the gym, you need to book them beforehand on on AUC Connect, because we have limited the number of students or faculty or staff who can use the gym and pool at any one point in time. So we need 24 hours bookings beforehand. And lastly, the student residences. Today is the last day of check-in in the dorms, and we're welcoming everybody to come back right away because the deadline is 4 p.m. And if you don't check in, you will lose your room because we are overbooked and we have a waiting list. And, thank you, and ready for any more questions.
Thank you, VP Dina Bryan. We'd also like to hear some comments from AVP Sarah Rafat regarding plans for back to campus from Human Resources.
Hello, everybody. Good afternoon. I echo my colleagues. We are very excited welcoming everybody back to campus, especially staff. But before I start, I would really would like to thank the administration staff behind the scenes who really supported us in accomplishing this goal and hopefully opening the campus on Sunday. These teams did a tremendous job, really endless working hours for us to accomplish this task. So thanks to everybody who contributed to this. I would like to indicate that the safety comes first to our staff. So again, echoing everybody, I'm asking all staff please to maintain wearing the masks and maintaining social distances. This is very important within our offices for their safety, for their health and safety. The most important question that we receive from staff these days is the flexibility of the work remote guidelines. And we have the guidelines published on the HR websites with the all questions and answers that we are receiving from staff. We concluded this week awareness sessions that a good number of staff attended, asking questions about the policy, how we will apply the policy, how they will obtain approvals. And we are updating our website on a daily basis with these questions and procedures and flexibilities that we have. Also, the HR team are available on the Plaza Floor admin building for any question the staff want to address or a specific case that they want us to help with. So please come visit the HR and be free to address with us your concerns about the work remote guidelines. One of the very common questions as well we are receiving is the daycare, when we open the daycare. And we are hoping to announce positive news during September about the daycare. Teams also are really working hard to accomplish this. So stay tuned. Hopefully we'll receive positive news soon and communicate. Thank you.
Thank you very much. Dr. Hussam, perhaps you could say a few words as well.
Thank you, everyone. I just want to thank all the AUC community members, students, staff, and faculty for registering, for following up, for coming, for showing, and after that, for uploading their vaccination to get these numbers. When we started all this program, we thought that we are just aiming to get 70% of the community, 75%. Right today, to have 80% of our community are vaccinated, this is a very good thing. I think it's a huge step. It shows just the leadership of the AUC as usual, especially in the last 2 days of the pandemic. And I think after 2 days, almost 2 years of this pandemic, everyone knows the regulations. Some variations show up from time to time according to the strand of the virus or the variant or something. And we are keen to communicate all this through the frequently asked questions on the website. Anytime anyone has any question 24/7, the clinic is available for this through the email, the medical serve, or the hotline, or could directly just communicate with anyone in the clinic members. We are going to be so glad to help, to advise, and to share the guidelines with everyone, including the vaccine, anything related to the cleaning processes for our offices, labs, dorms. And we hope all to stay safe all the time and healthy. Thank you very much.
Thank you so much, Dr. Hussam. And I'd like to open up now the floor for questions from our attendees. I know some have entered questions in the Q&A box, but I'd like to invite any of our attendees, if you'd like to ask a question to one of our panelists, just to raise your hand and speak out your question. Hanan, please go ahead and unmute yourself and you can ask our panelists your questions.
Thank you very much for all the efforts that have been made. Really, really, really appreciated. And we can notice the difference by visiting campus, actually. So much, much appreciated. I have two questions. One, Shireen kindly answered in the Q&A that the 350 costs for the weekly tests are going to be covered by the individuals. That's quite an expense for an individual with a medical exemption to pay 350 every week. So is the university attempting to do something about that, particularly if we're talking about students on financial aid or scholarships, as well as staff? And the second, in case when there is, hopefully never happens, an outbreak of a case in a classroom, do we cover all the students and the faculty cover the cost of the tests till the class is all negative? And the second question relates to bathrooms. If we can get a sense about bathrooms as common areas, what will happen to those?
Yes, let me take those. I can take those questions. So starting with what happens when there's an outbreak, yes, AUC will be covering the cost of the testing of both the faculty member and the students. Of basically the contacts of the case, of the probable case in a class. This will be covered by AUC, and that's the same as we have done throughout last year when we were in hybrid mode. As for the individuals taking the cost of the antigen test, yes, we have made allowances that the students on scholarship will be, AUC would be covering the cost of those testing for those students if they have not been vaccinated for a medical reason or any other reason, as well as AUC will be subsidizing the cost for some of the employees where we know that cost will become burdensome on them. So we have agreed a scheme whereby levels 1 to 6 will have a certain subsidy, and that will increase for levels 7 and 11. So that will be a scheme that's built on the salary scale. So 1 to 6 will pay £50, 7 to 11 will pay £100, and as of 12 and above, they will be paying the full cost of the weekly test. For the bathrooms, we are following a more rigorous disinfection program whereby each bathroom will have a tighter schedule of cleaning of minimum 4 times a day, and we will make sure that this is being followed very well. There's also sanitizers across campus, outside bathrooms, so all the sanitization, for the people to actually use them themselves, this is there, and we've increased the quantities in the public areas, and you'll find one inside or next to every single bathroom. Thank you.
Thank you very much. Hanan, I think you also asked a question in our Q&A box related to the breakdown of the percentage of those vaccinated and also the doses and types of vaccines that were administered. Dr. Hussam, do we have any data on this question?
The breaking down of the numbers, I think we could just get all these numbers by the end of the vaccination. I think right now all the system just give us the whole look about numbers. we could break it down when we just finalize today, if we are not going to have another days with the Ministry of Health. After that, we could just break down and get the accurate numbers of how a percentage of the different categories of the AUC community.
Thank you very much, Dr. Hussam. Are there other questions from our attendees? Just raise your hand and I can. Yes, Hanan, please go ahead.
Sorry, again, I'm asking too many questions, but we're getting very close. Just to confirm with Provost Abdurrahman, in case we all have on our syllabi now a statement about having to wear the mask as mandatory and distancing in the classroom. In the eventuality that the student isn't wearing the mask, am I allowed as a faculty after the first warning to put on the mask to remove them from the classroom?
Dr. Hanan, yes. The short answer is yes. First of all, I think we are, as educators, we need to educate our own students also about the importance of wearing masks for themselves and for others. So after your attempts to that students to comply with the regulations, and if he's not complying with the regulations, I think you can ask him to leave the room.
Thank you. Rhonda has posted a question in the Q&A box asking, when will the clinic not be too busy with vaccinations and available for faculty physical examinations? Dr. Hussam, do we have some information on that?
Actually, it's not an easy question to answer at the moment. Right now, today should be our last day in the vaccination, but we hope to have another extension. After that, I think by the middle of the next week, we could just say a rough time for starting all the examination and things like that. But in case if there's any medical emergencies that we need to deal with, the clinic is working 24/7 and dealing with the emergency cases. This is not stopping anything, even with the vaccination processing ongoing.
Dr. Hussam, is the medical clinic also accepting email requests for prescriptions and other services that they were offering previously?
Actually, yes. And we had, I think, dozens of cases in the last week. I was copied in some of these emails asking for some medical tests and lab tests and things like that. It just need to be sent to the medical served email. And after that, you will get the response.
Thank you very much. We had, let's see, similar question. Any other questions from our attendees? So I did have a follow-up question that many people have come to me and asked me about contingency plans. And I know the university has been working very hard, not only to maintain the safety of our faculty and staff and students, but also to generate plans, should the Delta virus increase and should that become an issue for us. Provost Dahab, could you talk a little bit about under what circumstances the university may restrict campus access or perhaps return to online teaching, and maybe what some of the contingency plans that have been talked about?
Yeah, of course. Yes, we have a contingency plans actually for what happens if the number increases on campus. So if we reach to a specific number or on campus or nationally, we may go to what we call it low capacity campus, which is specific classes will be delivered face-to-face based on the educational needs, and other classes will be fully online. And plan C, if the whole country is on a lockdown or the number really increases in AUC or nationally, we may also go back to fully online. That's why it's very important. It's very important. I stress on that too. Again, that every one of us to wear a mask and to maintain a social distance, because that makes us actually hopefully not get many cases on campus and to remain open. So we're not open till the end of the fall. We don't know if we're going to open for a week or two, or for a month, or for the whole semester. That depends on the numbers. And everyone can help us actually to go through the fall without actually having to go back to online if they maintain a social distance and wear a mask.
Thank you very much. I just want to echo many of the opinions that I've received from faculty who have been so happy about the arrangements and plans for social distancing in the classrooms. And the quick response over the summer to arrange for class spaces and for lower class sizes and all the other measures that have been taken by administration to ensure our safety. So this has really been an amazing feat for us. Hanan, you had a comment?
A quick question. Provost Abdurrahman, can you give us a sense about the numbers that are part of the contingency plan? What would the number be that will help us or make us take the decision to go for low capacity?
And if you allow me, I will actually ask Shireen to answer
Sure.
that. We have the numbers in place, but Shireen is
Okay.
the best person to answer that.
Okay, so basically we got the learnings from last year and the dashboard that we have built in place to be able to answer that question. So we have a number of triggers that we will be using as we move from phase to phase. So the first trigger would be if the national daily numbers exceed the 1,000 daily cases and above, that is time to roll back, to look at rolling back to hybrid or lower capacity campus. The second measure that we are, or the trigger that we look at, is the AUC 7-day rolling average number of COVID cases, which means on any given, so last week, the average number of daily cases was X. And that X, once it exceeds 15, that will be another trigger that will make us look at the decision, take the decision of rolling back into hybrid or lower capacity campus. And the third measure that we use to assess how bad the situation is getting is the number of AUC hospitalized cases. And if that number is equal or exceeds 5, then that is definitely also a third trigger to look at. Usually they come together. So usually if we see one, we'll see the other two, the national cases, the 7-day rolling average and the hospitalization. They always go together. But even if we have one or two and not the third, it will be time to stop and assess the situation and most probably take the decision of rolling back to a hybrid scenario.
May I have a follow-up?
Sure.
Are we, I mean, last year we had the CLT do the online training. So all of us are trained on the online now. Is there something for new faculty that's going to be similar in the eventuality that we have to go online?
Hanan, most of our new faculty have been teaching somewhere else too. Most of them, not all of them. And because we have a few of them who just received their PhD. So I expect that they weren't teaching, or at least I will assume that they did not teach before. So that means that they are also trained somewhere else to teach online. But in that case, I think also because CLT was also busy to train faculty who will use the dual delivery classrooms, I think now they will start looking into training faculty, new faculty on how to teach online. So that's in our plan already, Hanan. But thank you for the question. And Hanan, please, and I'm asking all the community to keep those questions coming. We cannot claim that we know everything. We're facing the unknown. And those questions and those concerns makes us actually aware of what to expect. So please keep those coming.
Are there any questions from our attendees that you'd like to ask for our panelists? We had a very good question from Ken Fox posted in the Q&A box regarding where to get masks on campus, for example. If your mask breaks or you need it for any other purpose, you can attend the AUC clinic. Dr. Hussam has said that the staff will have backup masks in their and staff will have backup masks in their departments. So that's good information to have. Thank you. Carolyn, would you like to ask your question to the panelists?
Oh, thank you, Michelle. Yeah, my question is about the actually the windows in the library building, because they were designed in a way that they're not open. And, for ventilation purposes, I was wondering if this could be, considered that the windows are open now that, especially that we have, the special security gates that are on the library entrance. Have one that leads to our offices at the side door of the library building. So I was wondering if this can be reconsidered, the issue of windows in the offices in the library building. Thank you.
We can definitely have a look, but if the windows don't open, that will be that won't be possible to make all these changes. But if there is a simple mechanism that we do that change, we will certainly have a look at that.
Thank you.
Thank you. Other questions? I did have one I'd like to address to VP Dina Burai. Last year, we had a provision for students who had COVID or personal family issues where letters were sent from the Dean of Students, sometimes from the clinic, to let us know that they had situations and that we should provide them with support and accommodations for the period of absence. Will that still be happening this semester?
Yes, and I'll be sending a very similar message again today, at the end of today, right, so that it's before classes begin. It'll be the same process. Again, the verification, if they, verification of their, if they get COVID, they'll send it to the clinic, and then we will, as usual, the Office of Dean of Students will inform each of the faculty. And for non-COVID, because of course, you know that there are also non-COVID illnesses, it will be the same process, Michelle, so that we make sure that we're following the system. And of course, the key is that they give us the documentation so that we can process it as fast as possible.
Thank you very much. Azza, would you like to ask your question to the panelists?
Sure, Michelle. Hi. So yes, I'm excited to be back to campus, and I've been using the bus for several days the past 2 weeks, but not everyone is wearing a mask. I don't want to be mean or anything, but how do you plan to ensure that this happens to avoid spreading the disease if someone is infected?
Can I take that one? So Azza, it's nice to see you virtually, and please visit in the office.
Yes, hi, Dr. Ihab. Good to see you again.
Good to see you. So let me say, Azza, it's really hard to police 10,000 people on campus. If we ask the security to do it, then we're asking for troubles between our security and our students and our security and our community. I think as the best way to do it is you go directly to the person and nicely ask him or her to wear the mask. I have been doing this on campus in the last few days, and it never failed. I go nicely and ask the people to help us keep the campus open by wearing a mask. So please, when you see someone, go and talk to him and to her nicely, and it never failed. So I don't think it's going to fail with you.
Okay, thank you very much, Dr. Ihab. I'll do that.
Thank you. Thank you.
Doha, would you like to ask your question directly to the panelists? Doha has asked about the outlets on campus. Will they be accepting AUC pay? I think she was reporting that it wasn't available during orientation. VP Shireen, could you address that question?
Okay, I know that they take AUC coin. I am not too sure if they do take AUC pay, but you can send us you can email us the question at VPMO and we'll get you the exact answer.
Thank you very much. I think
I just want to chime in, sorry, it is AUC coin, and you just have to download the app on your phone so that you can get access to all the different services and outlets.
Thank you. Hanan, you had your hand raised as well?
Yes. Regarding the attendance policy, I know we are back on campus, but again, the situation is very ambiguous, to say the least, with all sorts of possibilities. Do we adhere to the attendance policy as it is stated, or there is more flexibility in the attendance policy as it stands right now? That's one question. The other one regarding many places, and maybe that's for Shireen, are now moving to non-cash transactions in order to reduce the possibilities of the circulation of cash, which is in itself quite a high risk thing. Is the same thing going to be implemented at AUC with regard to the different outlets like Quick or Food or what have you?
Yes, I know that the food team is working on making all those and refreshing all the menus, etc. So the AUC coin is fully active for all the outlets, and I believe that this is already in place. We might take a few days of the first week just to make sure all the menus and all the options are updated on the app. But AUC coin is already working for all the outlets. Even the parking system now is also cashless. So as much as possible, yes, we're moving towards everything to be cashless. The printing services also, it's going to be cashless. So yes, more and more of the services that before used to require cash will no longer do that as of this semester.
Regarding, Hanan, your question for the attendance policy, yes, we've been applying it for the last semesters. And as I just noted, I'm going to be sending out an email saying the same thing, Hanan, as we are following, the 3 weeks max policy. And of course, when it comes to the COVID cases, and if they have to, if they're able to physically do things online with them, I do hope that all, and faculty have been very, very, flexible with those students, Hanan. And it is at the end of the day, your judgment regarding student performance and attendance if they are not able to come on campus. And certainly that's for the COVID and for the non-COVID illnesses too. We haven't changed the policy, Hanan. And if there are any issues, we will handle them together. If there are problems with some students, you need our support, we will support.
Thank you. Other questions from our attendees? Rhonda, would you like to ask your question directly to the panel?
Hi, everyone. I was just wondering, I've never used actually AUC Coin before. So I was just wondering, where can I get more information on everything about it, how to use it, and I just wanted to know more details about it since it's going to be applied in most outlets. That's it. Thank you.
We can make sure that all this information is updated on the website. So we will double check, and if it's not already there, we'll make sure that it is there first week of the semester.
Okay, thank you.
Welcome.
Other questions from our panelists? I have been approached by a number of people asking me about the vaccinations that are being administered on campus and the documentation for those. For many who are traveling abroad, these vaccinations require some kind of QR code or some kind of further authentication. Maybe Dr. Hussam, you could speak to this, or VP Shireen Shaker, you could speak to this. Will the vaccinations that are being offered on campus also include a QR code, or are there other procedures that faculty and staff and students have to take?
Dr. Hussam, you can take this one.
Okay, actually, the QR code is available after the second dose, whatever the dose you are taking, even it's Sinovac, Sinopharm, AstraZeneca, J&J. The point is that we are trying to work closely with the Ministry of Health for the IT department to get all the batch of the names who are vaccinated from the AUC community, send it once, and after that upload it on the system, and we proceed with the QR code, the final QR code to be delivered to AUC community members. We are still in progress to communicate with them. Once we have something concrete and final, we'll communicate it with AUC community members.
Thank you very much, Dr. Hussam. Other questions from our panelists? such a wonderful conversation. Hanan, you had another question?
Okay, and don't laugh at me. What about the designated smoking areas? Are they still operating in the normal fashion?
I hope not.
I hope so.
They are still working.
I would love to answer this question, please, if you would give me an opportunity. No, they are there. We've socially distanced those as well, but they're still there. But the reason is that, I mean, those are the reasons we can have a completely smoke-free campus. So that is the solution we have. So it is better. I mean, so I understand. I probably understand your concern that better not to have them at all. However, you need some.
No.
They are there. The answer is they are still there, but we've social distanced the chairs so that they are. I think they're 1 meter apart, but they are definitely there.
I think Hanan is gonna like my suggestion here. I think we should make it for a fee, Shireen, and
oh yeah. Give me a salary raise.
and actually donate that fees for the people who cannot pay for the testing.
Give me a raise, and I'll be the first one to do that.
Okay, Hanan.
Thank you. Other questions from our attendees? This is a wonderful opportunity to ask our university leadership all these questions that have been. I do have a question for VP Sarah. Some of the staff, as you know, have approached me regarding overtime. Are there any updates on the policies or procedures for that now that we are returning to campus?
Thank you, Dr. Michelle. This is an important question. Overtime is directly linked to the campus operations. So it naturally goes without saying, if there is a mandate that the staff that are eligible to overtime to work extra hours for the campus operations, definitely overtime will be active. COVID was a special situation because campus was not fully operating. So it goes without saying, impacting extra hours of payment of overtime. It's not
Thank you so much.
Pay, that's what I mean. It's not a guarantee in the package.
And Sarah, let me add that also we will have staff working as per the need on Saturdays, because we are teaching on Saturdays. And that means that also they can claim that as an overtime.
Thank you. Other questions from our panelists or from our attendees for our panelists? Perhaps I'd like to invite our panelists if there are other comments you'd like to make to the group attending here.
More question. I think that's for you, Dr. Borai, to answer on the Q&A before we go to.
This is from Doha. Doha, would you like to read the question? I can.
Yes. She's asking about the mandatory health insurance for graduate students. Yes, you should. All our students are required to be covered medically. So if you need to get more information, please write to the OSL, the Office of Student Life. That's where they provide the services, right? OSL at AUC Egypt, and we'll provide you more details and where to go to read about the medical insurance.
Okay, God forbid, but in case of a COVID, someone being infected with COVID, would this help in any way, or is this just a mandatory general health insurance that has nothing to do with COVID? Thank you.
Exactly. It's not just COVID, but of course, if you need any medications or coverage, it will cover you. You see, it's not just about COVID, or it's about your health. And that's why it's mandatory. So yes, it's covered, as well as anything else, God forbid.
Thank you. Rhonda, you had a question?
Yeah, and not really a question, just an observation. I took a quick look at AUC Coin, and it's not compatible with Android. Maybe we can do that, something about that in the future, so that everybody gets to use it. It's just that it's only on iPhone. Given the COVID lifestyle we have to go through, it would make using it much easier. Just an observation. Thank you.
Yeah, Duha, we're working with the IT team on many of those cashless initiatives. I should bring that up. And either this is not, it could be that this is not updated information or that we really need to include Android. So I will communicate that.
I just took a look at the website, and it's only iPhone compatible. Bye. Thank you.
Welcome.
Thank you very much, Rhonda. If there are any further questions before we close the session today, I'd like to invite you to either type those in the Q&A box or to raise your hand, and I'll give you the floor to ask the panelists these questions. Kim, would you like to ask your question directly to the group?
Sure, I can ask my question. I'm just wondering if alumni are allowed on campus if they're fully vaxxed. For example, if we want to have a guest lecture from an alumni, is that permitted?
So those are two different questions, Kim. Let me say that any visitors are not allowed to campus unless there is a reason for them to be on campus. So to answer your particular question, if there is an alumni invited to be a guest lecturer, yes, he would be allowed to campus.
Provost Ahab, perhaps you could say a little bit more, some new procedures for scheduling events on campus for departments has been initiated just this past week. Perhaps you could tell us a little bit more about this, or?
So the reason that we're coming back actually to campus is to allow the learning that's happening outside the classroom to happen. That was not happening during the online. That's why we're coming back to campus because of that. I'm sure that our faculty did a great job actually delivering their courses online. I believe that that's the difference between delivering those courses online and in face-to-face can be noticed, but it's not really the main reason for bringing our people back to campus. So we will be holding events on campus, but we have to be very careful on who to invite to those events. External people will not be allowed to campus. We do not have the mechanism in place to verify their vaccination, and it's not that easy to ask them to come and bring their vaccination certificate with them. It's not that easy, and our IT team has been really, really busy developing systems for us through the summer in order to allow everyone on campus. So events will happen for AUC community. If you're inviting external to be a guest speaker to a panel, they will also be allowed. But if there is, for example, a competition where we will invite students from other universities, maybe we should actually have that competition online. We're not ready to invite a big number of people to our campus while actually not making sure that they are vaccinated. And as of today, we do not have the system in place to verify their vaccination. Maybe in the future we will consider that, but our IT team really are overwhelmed by the amount of apps they have been developing in the last few months.
Thank you. Hanan, one final question for our panelists.
A quick follow-up on that. The commencement then, would it be without parents?
Thank you, Hanan. That's a great question. We have two big events that we are studying and looking at now. Those are commencement and the inauguration of our new president too, Hanan. This is not the only big event that commencement is not the only big event that we're looking at. So the answer today, Hanan, may differ tomorrow. It depends on the number. So stay tuned, Hanan. We have plan A, plan B, plan C for the commencement and for the inauguration. I'm going to ask my colleague, Dr. Dina Borai, to just discuss the plans for the commencement as of today. But which plan we're going to actually implement, that depends on the number just before the commencement, Hanan. Dr. Dina?
Thank you, Provost Ihab. Hanan, I wanted to let you know there are the two scenarios. Scenario one, which is the good scenario, where we will have we have for each school, it's going to be school-based commencements per school, Hanan, and each school will run like Haas and the School of GAP, they will run one commencement, because remember, we have 3 classes who have not had commencement: Spring 2020, Fall 2020, and Spring 2020 classes. So in the case of the 2 schools, there will be one commencement, and in the large school, School of Business and the School of Science and Engineering, we will have 2 commencements each. Therefore, a total of 6 commencements. We are planning, though the dates are set in the, as of September 20th. We haven't yet given out the exact dates, but it's between 20th of September and the end of September. The scenario one is where we have the max of 318 graduates with 4 tickets each. For family members, the maximum is 4, and of course the stage party, and that's it's around 1,500, 600 attendees. That it depends, again, as Provost Ihab said, depending on the COVID situation. Scenario 2, when it's not really looking very good and safe, will be just the graduates only, with no family in attendance. But we will have very good live streaming, so everyone in their homes or wherever they are will be able to watch the graduate being graduated. So it'll just be the graduates and the stage party, a maximum of 400 attendees. So that's the plan, Hanan.
Thanks much.
Thank you so much. And thank you to all of our panelists here for your information that you've shared so generously with us today, and for your positive and warm spirit. We thank all of our attendees for your wonderful questions and your support for our community. And I wish all of you have a wonderful first week of classes. And until next time for our campus conversation, bye for now.